deeply worried. We are seeing the infection rates that seem to be much higher than what we have seen before. And Premier Makura is dealing with this challenge as best as he can. And I know that the acting Minister of Health is also involved, and we are very grateful to have a soldiers corps who are able to go in and assist. The deployment of more medical personnel is obviously one of the things we need, as well as hospital beds. And I know that they are opening up as many hospital beds as they possibly can. And of course, the challenge of oxygen availability and ventilators is another one. So we are involved in a very, very serious situation in relation to the pandemic in Gauteng, and we're also seeing it rising in other parts of the world, here as well in the Western Cape. I was talking to Premier Alan Winde earlier, and we're seeing signs of that as well. So we are in the third wave, as we did say, and the issue of moving on to another level is a matter that is going to be discussed by the NCCC, and the NCCC will meet and make recommendations, and clearly there seems to be indications that we've got to increase the measures, particularly in Gauteng, that we have imposed or put in place. And Karen, you ask a very important question. What do we do as the infection rate is going up? Do we keep the economy going at the expense of lives? And we've always said that we will have a balance because the lives of our people are extremely important, as are their livelihoods. So we have always sought to keep a very good balance. When the pandemic started, we did impose a very hard lockdown, possibly harder than many other nations, and that helped to bring the rate of infections down, and everybody did see the need for it. But with time, we had to ease off, and we had to move from level 5 to 4, and finally to 3 and 2 and 1, and now we've moved back to 3, and the infections are just continuing to rise. So that calls for us to review exactly where we are and continue to see how best we can create that delicate balance between saving lives as well as the livelihoods of our people.